Hello, everyone. So, welcome. Today, we have with us Dr. Jeffy, who's currently training and practicing medicine in Germany. Doctor completed her MBBS from Believers Church Medical College Hospital and later moved to Germany, where she successfully cleared the medical language exams, that is your C1, FSP, and she's currently working as a junior doctor in Germany and is now preparing for her permanent medical licensing exam. Now, her journey offers a clear realistic perspective on the Germany pathway for international medical graduates. And we are excited to have Doctor share her experiences and insights with the Go Campus World community. Thank you so much, Dr. Jeffy, for taking time to be with us here today. A very warm welcome to you.
Thank you, Ashwini. Thank you for having me. It's also my pleasure.
Thank you, Doctor. Doctor, just for our audience to understand you a little bit more, can you please briefly introduce yourself and your current role in Germany?
Yeah. My name is Dr. Jeffy Koshi. I am originally from Kerala in India. I completed my medicine undergraduate studies, that is the MBBS from Kerala only. And then I moved to Germany by early 2024. And then I prepared for the first exam, that is the Fachsprachprüfung. And I completed the exam, I cleared the exam, and then I started working as a junior doctor in Germany. I'm working here since the past 1.5 years.
That's really nice. So, doctor, at what stage of medical career did you decide to move to Germany? And was there a specific reason? Like, I would like to know why did you specifically choose Germany?
Okay. So, like any other medical student, no, once we reach third year or final year, we will be thinking about post MBBS, what to do post
Yeah.
MBBS.
Hmm.
So, I had many options in my mind. I started actually in third year to think about the other options. Of course, NEET
Mhm.
PG was one of them, and I also wanted to know about the career options abroad. So, I researched
Mhm.
on myself, and in final year, I actually came across Germany. So,
Okay.
what struck me most was the transparency. So, there was a particular fixed route in which the international graduates can do their
Mhm.
residency in Germany. But the only problem was that that was
Mhm.
not something very famous at that time. So, I did
Sure.
my self research and I understood at a particular point of time that, yeah, this aligns to my future goals. And that's how I decided that Germany is my future pathway. That was it.
Okay. That's nice. So, doctor, for all the MBBS doctors watching this podcast today, because that's where largely our audience is, can you walk us through your journey? And just for their understanding, can you tell us the major steps involved in this pathway for international medical graduates?
Yeah. Okay. The first and foremost thing will be learning German, of course. If I tell you how I did it, I started with my German language during my internship. I
Mm-hmm.
completed till A2, German A2 during my internship, and then I started with B1 post internship. So I did till B2. So that is the basic. You need at least B1 German language to apply for the residency program in Germany. So the first and foremost thing will be language. And then
Mm-hmm.
after B1 or even after B2, you can start with the document processing. There is a set of documents that you need to submit to the medical council here in Germany. And after
Mm-hmm.
that, they will verify your document, and then you can apply for the visa once your documents are verified. You apply for the visa, you come here, you need to give the exams. And after
Mm-hmm.
passing the first exam, that is the FSP, the Fachsprachprüfung that you would say in German, you can start
Mm-hmm.
working. And parallelly with after the FSP, parallelly while working, you can prepare for the second exam, that is the KP exam. That is the permanent exam. And after passing the permanent exam, you can actually start your residency in Germany.
Okay, that's nice. When you're saying it, it sounds like, oh, that's all. It's very simple. You just have to do language exams. You just have to do this. But I understand because I've seen so many doctors. We talk to doctors from different countries, aiming at different destinations. We've seen couple of them quitting the path midway, and I've seen couple of them who come back from Germany who couldn't do the exam over there, the German language at the final level. I guess you know the level of frustration. They come back and they say, no, we cannot do it anymore, and they've taken a different pathway. And some doctors started from basic German and in between they'll skip it. How did you stay motivated throughout this, doctor? Because now when you're saying it, it sounds very simple, but I know doing it, learning a new language, you have to completely unlearn your English, and learning medicine completely in a new language is a difficult task. What kept you motivated throughout this journey?
So, as you said, when I said it, that sounded easy, but it wasn't that easy. The only thing that kept me motivated was that I started the journey and I need to keep it moving. No, there
Mm,
wasn't an alternative that I've chosen. That's how I
mm,
kept myself motivated to continue with the
mm,
language. And I think I have taken this German language learning process a bit more serious than most of the
mm,
people, I guess, because I had no prior experience with German. German is like my third language or fourth language right now. So from
Okay.
the beginning itself, I've taken an interest in learning the language very well, and that has helped me a lot. The other things that the exams and everything that came later with the coachings and everything, it was doable. But still, I
Okay.
think learning the language well was the main thing and that's what kept me motivated that I need to make it work.
That's nice. And what exactly is tested in FSP, doctor? Now, this is after your C1, you give your FSP exam, right?
Yeah, you can also give your FSP after your B2. It's not
Oh,
mandatory that you do C1, but it's better and advisable to do C1 so that your German becomes a bit more better.
okay, okay. Oh, so even is not mandatory kind then. So after BT, if you can directly do your FSP.
Yeah, yeah.
Oh,
After
oh,
B2, once you have the B2 certificate, you are like eligible for FSP exam. You can register for the exam.
okay. So did you do your C1, doctor? You gave your FSP directly after.
No, no, I did after B2 directly FSP. FSP is like a medical C1 exam.
Okay, okay. And what is it tested over here? It's again language, or you will have like our international exams are, whether it's PLAB or USMLE, or we have this AMC Australia exam. It is that kind of medical questions. What is it? What is it there in FSP exam?
FSP is like a mixture of both. It's known as a
Mm.
medical language exam, but what you
Mhm.
do is you get a patient, you need to take the history and you need to find a diagnosis and you need to write a case history, and then you will be having a viva session with three examiners. So that's
Oh.
all medical related things only. But I think
Mhm.
the primary focus goes on to how well you can German or how well you can understand the people. That's what FSP is all about. So even if your medical knowledge is not that important, yeah, sure, when you get questions from the basic medical things and if you don't answer those questions, you will definitely not pass, but the major focus goes to the language only.
Okay, so this includes both your MCQ writing kind plus OSCE, or how does it work, doctor?
No, there are no MCQs. At the beginning you will be getting a patient, you will directly go to a patient room and you will converse with the patient, you will take a proper history, and then you will come to a diagnosis, and after that
Oh.
you will write the case sheet of that patient, what you have got, just like how you write a medical report in any hospital. And after that you will have a viva that is also based on what the patient, the complaints of the patient, or and things like that,
That's
but there
nice.
is no MCQs, no.
Okay. Doctor, we understand that you're currently preparing for your permanent medical licensing exam. That's the knowledge exam. So, just for IMGs to know what is the difference between FSP and knowledge exam, can you please share some insights on this? What should IMGs know about these exams early on?
Yeah, okay. That is the second exam that's known as Kenntnisprüfung in German. So it's a
Mm-hmm.
comprehensive clinical exam. Just like the FSP, you will need to take a proper case taking of a patient, you will get a patient. You will need to take the case and you will also need to do the complete examination of the patient. And then you need to write everything else as like a medical report. And then you will be having an extensive viva session, and that will be around 1 to 2 hours. That's a bit challenging, and you'll be getting questions from almost all fields in medicine. It's from general medicine, general surgery, pediatrics, obstetrics,
Yeah.
gynecology, radiology, everything. So you will be have it's like a medical students know it like your final year MBBS exam. It's like that vast and elaborate. In contrary to the FSP, what they check here in KP is that how well you're with the English with the medical knowledge. It's not just a language exam, but you will be checked. You will be you are expected to know everything in medicine. So it's more of a clinical oriented exam, and that's why I think KP is always known to be more difficult than FSP.
So, is knowledge exam mandatory for every doctor in Germany who's progressing in career?
Yeah, yeah, because for all immigrant doctors, the who have completed their studies outside Europe, this KP exam is mandatory.
Okay. So you can apply for residency or let's say for training jobs only after knowledge exam, doctor?
Yeah, true, true. Because after KP, you will get this permanent registration that is known as approbation. So only once you have this approbation, you are eligible for PG actually.
Okay. That's nice. So just for our doctors who are watching the podcast today to make their understanding a little bit more better. So this is the difference between a temporary license and permanent license. So currently you're also working there on temp license only, right? Till you give this
Yeah,
knowledge exam.
yeah.
Okay. And if in case someone fails this knowledge exam, what happens, doctor? They can again reattempt.
Yeah, there are 3 attempts for the KP, the permanent registration exam. And one thing I forgot to tell you is after this temporary licensing exam, you can only work in that particular state where you have applied. And only after passing the second exam, you are eligible to work everywhere in Germany. That's one thing.
Okay. I mean, you've seen any cases where doctors failed all the three times, and what happens next
I
if they
don't
fail?
I don't have a personal experience. No, I've seen people failing the first attempt or anything, but luckily all of them that I know have cleared in the second attempt. I don't know anyone personally, so I don't know.
So how did you secure your first, let's say, the junior doctor position in Germany? Like you had to take support of any recruitment agency, or you did it all by yourself, just via online platforms? How did it work?
Yeah, I did everything myself actually. So after clearing the first exam, I started applying for jobs. I looked in the normal platforms like LinkedIn. I even looked into hospitals, the online websites of the hospital nearby where I am living. And then I applied. Actually, I applied wide. Actually, in all over the state, I've applied. And then I got interviews. And luckily, I don't know if it's by luck or anything, but after the first interview itself, I've secured the job. I have given only one interview. So but I've heard people having the opportunity to give 2-3 interviews because they all came together and then they got the luxury to choose a job. But for myself, it was like after the first interview itself, I have said okay to the job. So that's how it is.
Okay, okay. So, do hospitals in Germany prefer fresh medical graduates or doctors with prior clinical experience from their home country?
Also, prior clinical experience is actually not mandatory.
Okay.
What they actually look into is how well you can converse in German or how well you are with the language. That's what I personally feel. When you go for the interview, they will be asking you about your experiences, everything. But what they actually look into is how well you can understand or how well you can, how do you say, merge into the system. And if you have a prior experience, that is well and good, that's good, but that's not mandatory.
Thank you, doctor. Now, doctors, I'm sure many specialists will also be watching this podcast today because doctors do explore global opportunities. Now, for specialists watching this podcast, what's the pathway for them? Because let's say if they've completed residency from India and they're exploring to work in Germany, is there a shorter or is there a fast track pathway?
Unfortunately, there is no shorter pathway. It's the same. The pathway is the same because even if you are a specialist in your own country, Germany doesn't find it equivalent to the German PGs. The only thing is that once you come here and you go through the same pathway and secure a PG seat, maybe securing a PG spot will be a bit more easier. And also maybe to finish the PG in instead of 5 years, maybe in 4 years. But that depends on which hospital you work and in under which show do you work under. But the basic pathway is the same for everyone.
Okay. Now, because we just spoke about specialities, like how in other countries, like in US, UK, Australia, or NZ, we say certain specialties are IMG friendly specialties and certain specialties IMGs, it's very, very difficult to get. So, are there any IMG friendly specialties in Germany or every specialty IMGs can try and they have very good chance to get it?
There is a good chance that you can get into any specialty, but the highly sought after specialties like radiology, dermatology, that is a bit difficult.
Okay.
That's a bit difficult. That's even difficult for the Germans to get into. So it's not like as you are an immigrant, you don't get this specialty. It's not like that, but it's always sought after branches. No, it's known for its work-life balance. So it might be a bit difficult, but the surgical specialties, medicine, and everything is comparatively easier to get into.
What specialty are you aiming at, doctor?
I have currently 2-3 options, but medicine is my first priority.
Okay, okay. Now, because we spoke about work life balance, I think this is the first question that doctors do ask us when we speak about different countries. How's the work life balance for doctors in Germany? Like for how many days you all work or for how many hours you all work? Will you be able to share some insights on it?
Yeah, yeah. So Germany is one country that offers a very good work-life balance to doctors that I should say. So there are fixed working hours in Germany. You can only work for a maximum of 40 hours per week. So
Okay.
for example, if you are doing the normal shifts from morning to evening, it's like 8 hours or 8.5 hours every day so that you complete only 40 hours per week. And if you're doing night shifts or if you're doing evening shifts, there are different kinds of shifts in Germany. So you will be either you'll be getting the next day off or you'll be compensated in your salary. And there is also an option for 31 days of paid vacation every year. So I think altogether the work-life balance is better than compared to so many other countries in Germany.
That's nice. And doctor, because you've done everything by yourself, I guess each step, and you've
Mhm.
seen the process before, roughly what should IMG's budget for Germany pathway? What will be the expenses, kind of including language, the training, the exams, the relocation process? Will you be able to give us some number?
I can't give you a concrete number, but I guess the language expense depends on where you are taking your language courses from. So there are a wide variety of packages from variety of institutions. Till B2, it can be anywhere around. I can't say you a number. It depends on
Okay.
where you take your
Okay.
language from. And then the next expense comes in the document attestation and translation, and that will be anywhere around for attestation around 20,000, and translation also around 20-25,000, depending on how many documents you need to attest and translate. There will be anywhere between 15 to 20 documents that you need to translate and send to the medical council here. And after that, the main amount that you need to have is the blocked account. So the blocked account is what you need before the visa, for the visa application actually. So it is an amount that you need to put in your bank to show that you can sustain here in Germany once you come here. Because once you come here, the initial stages you don't have a job. So there should be some surety that you would be able to sustain yourself in Germany. So that varies from every year to year in every 6 months. So when I came here, that was somewhere around 12 lakhs. I think that's now anywhere around 14 lakhs, I guess. But the
Okay.
thing is that that amount will be credited back to your account. Once you come here and open a bank account, you will get this amount divided by 12. That is, you get an amount from this for the first 12 months back to
Okay.
you. That's something that you get back. So it's just that you need to show this lump of money initially for your visa, and then you get it back. And obviously, after coming here for the FSP, for the exams, you need to take a coaching. So there are options to pay yourself for the coaching classes, or there are also options to get funding from the government. Because you are coming as an international person here and you want to integrate with the system here, so there are some schemes that are provided by the government for the to make the integration smoother. After the blocked account, you will also be needing a specific amount for your language processing, your
Okay.
language studies, then for your document processing, and also for your accommodation here in Germany once you come here, and also for the exams for the FSP and KP. So it's very subjective. It can vary from person to person, but it can be anywhere around 18 to 20 lakhs.
Thank you so much, doctor. I think that's a lot of information for aspiring doctors or looking forward to explore Germany. Doctor, now you've been in Germany. I'm sure you've seen your colleagues, peers, juniors. I'm sure many of them will be reaching out to you asking for support and help. So, what mistakes do you see aspiring doctors repeatedly making, especially in their learning phase or in their job application phase? Anything that you want to highlight with your experience?
Yeah, I think it is underestimating the German language. There,
Okay.
I understand that after completing your MBBS, you want to commit to a pathway and you want to be successful. How do you see? You rush the process and you will be like, okay, I will study till B1 or something, and then I will do it later once I come to Germany. But that's one of the biggest mistake that I have seen. You shouldn't underestimate the language, because knowing the German language is the first and foremost thing, and that is your foundation here. So you should take your time, understand and learn the language very well, so that your further processes once you come in Germany will be a bit more smoother. And also, you shouldn't have unrealistic timelines. Germany is a country where there is a lot of paperwork, bureaucracy, so everything will take time. From submitting your documents to document processing to getting your visa to getting a date for your exam, everything takes a bit of time, longer than in other countries. So you should have a realistic expectation. Yeah, that would take around 1 to 2 years for the actual pathway, or to have a permanent registration in Germany. It's time consuming.
No, because we spoke about, I think we spoke about specialities, we spoke about the pathway, we spoke about the expenses that doctors might come across, and we spoke about work life balance. Now, the obvious question that doctors would like to know is what is the approximate starting remuneration for junior doctors working in Germany?
So there is a fixed salary scale in Germany for doctors. So your salary will be based on this fixed scale, but it can vary from state to state. But I would say anywhere above 5,000 euros brutto. Brutto is like before tax. You'll be
Okay.
able to earn in Germany as a junior doctor once you start. And then you'll get increment every year based on your experience.
Okay. And doctor, because you have I mean, you have so much awareness about the process and you've done everything by yourself. Now, once you finish your residency in Germany, have you seen doctors working in other countries or at least in Europe? Any other countries that you can actually directly go and start working, or is it limited to only work in Germany?
No, actually, German residency degree is actually valid all over Europe. I have seen a lot of
Oh,
doctors who have completed the German residency in Germany, and some have moved to Switzerland. That is a very good option because the pay is even more better in Switzerland compared to Germany. So that's one of the most favorite or sort of the pathway after residency in
oh,
Germany.
that's nice. So thank you for all the information you've given, doctor. So we are closing this podcast for today. Now, let's say for all the doctors who are listening to this podcast and who are a little confused about choosing Germany pathway, what would be your honest advice?
The only piece of advice that I have for everyone choosing the German pathway will be to learn German. So it's very important, and then you need to also have realistic timelines in your mind. It is draining emotionally, physically, mentally, and also financially. It is a draining process. It might take time, but once you come here and once you get into the German medical system, it gets easier.
Okay. And are there many Indians, Asians working in your hospital? Can you see, like in UK or in US, we see Indians are there everywhere. Like they're dominating in many of the specialties. So how is the condition here?
Compared to other countries, there are a lot of immigrant doctors, but Indian immigrant doctors are lesser compared to in UK or US. For example, where I work, I am the only Indian doctor. But there are doctors,
Oh.
immigrant doctors from many other countries. From India, I am the only person. But I've also
Mhm.
heard from other colleagues, for example, in south of Germany and everywhere, there are a lot more Indian doctors.
Okay, okay. So you don't feel sometimes scared or kind of having the fear of I'm working here alone. What if some doctors fear racism, attacks, all that. You don't fear all that?
No, I didn't have any experience like that, and also my colleagues are very nice. I am very comfortable working with them, and they have also tried to make me comfortable from the beginning. So honestly speaking, I didn't have any racistic. I haven't heard any racistic comments or anything like that till now. But yeah, that's also possible when you work in a big community and when you are a minority. There are chances. Luckily, I haven't had any personal experience till now. But in beginning, it will be very difficult. You will be constantly questioning yourself if you are doing everything right. If you're if your German is okay, you will feel that pressure at the beginning. But once you get into the system, like I said, once you know how people or what people mean when they say something or what they expect from you, once you get into the system, and that takes anywhere around 6 to 8 months, I would say. Till then, you will feel a bit lost, and then it will get okay. It will get better. That's how it is.
Oh. Now, do you feel anytime, doctor, you took a wrong decision? Do you feel I
Uh,
should have also chosen US, UK, Australia, the popular destinations?
Honestly, no. I haven't felt like that till now. No.
That's nice. So I think it was wonderful talking to you. Now, for all the doctors who are aspiring to get into Germany, now you know where to go to for the advice. You'll have to book one-on-one mentoring session with the doctor. The sessions are open on gocampusworld.com. But let's say when you visit gocampusworld.com and if you see that there are no bookings or there are no open slots to book, that means that all the slots have already been taken. So you don't have to worry. You just have to click on the notify me button, which you can see on doctor's profile. So doctor will be immediately alerted that you are looking for a session and we will personally talk to doctor and open the sessions for you. Yeah, this for all the serious doctors who are exploring Germany and who want right guidance. It's not about exploring things on anonymous websites, different articles that's written. You don't even know who's written the article, who's commenting on the article. Instead of believing such articles, such writings and taking decisions, speak to right people. Speak to people who are already there in the healthcare system. Speak to people who are already living this each day. They'll be the right people to guide you, to advise you, which will help you in your decision making. So thank you so much once again, doctor.
Thank you
And
so much.
all the best for your knowledge exam plus for your residency training.
Thank you.